Hello guys, welcome back to my YouTube channel. I'm back again with another reaction video. We are medical students and obviously we think it's appropriate. It's right for us to react to this video. Today we are going to react to the Find the Real Doctor on the Jubilee channel. So Jubilee, thank you for the new idea.
You guys were on call. What was your least favorite thing to be woken up by?
I got a little bit annoyed with the Tylenol call, but you know, I had to do what I had to do, so.
I did have to see a patient for like herpes in his eye, so that wasn't very pleasant.
I am a doctor. 5 are posers. 1 is the real deal. In a room full of liars, can these teens find the real deal?
There are 5 fake doctors and there's just one real doctor. So I'm going to figure out who it is.
So, how are we feeling?
Oh, we're feeling good. We're feeling good.
Yeah, I feel like maybe a little more confident than I should be now that I get a look at you.
They ain't ready. They ain't ready. Okay. Number.
Based on just looking, who do you think is a doctor?
Oh my god, I need to see their faces. I haven't looked like at their faces. Okay. I feel like the doctor here, oh, it's crazy. I feel like it's this girl here.
I don't know, there's something about this older guy, this other man, the second man.
But you could be an actor though.
He could be an actor, a very good actor. It's just that thing of like older consultants, they always look like that.
Yeah.
With glasses, with the bald head.
Like he has a typical doctor
appearance.
Exactly.
Yeah. But he could be lying. So.
So, how are we feeling?
Oh, we're feeling good. We're feeling good.
Yeah, I feel like maybe a little more confident than I should be now that I get a look at you.
They ain't ready. They ain't ready. Okay. Numbers 1 through 6 in that order. Could you tell us your specialties and what school you went to?
I'm a dermatologist and I went to UCI.
I'm a urologist and I went to University of Tennessee.
I'm an emergency doctor and I went to UCF as well.
Physical therapist, Rutgers University.
I'm a pediatrician and I went to Drexel University.
I'm an optometrist and I went to Southern California College of Optometry.
Number 6.
Bro, I think it's the last one.
Really?
Yeah. I feel like it's the last one.
I don't know. The person that said she went to she's a dermatologist. Her skin is amazing. Her skin is beautiful.
And that's the reason why she chose that.
Yeah. And I think this guy that said he's a physical therapist.
Yeah, because of his
fitness.
body. Yeah, he's into fitness. And he feels like, okay.
See, we're already fishing you guys out. Come on.
Oh my god.
Okay.
Can you tell me what 20/20 vision means?
Yeah, so basically it's kind of complicated. There's a lot of like physics to it, but there's a certain angle that's subtended by the letters that are on the Snellen chart that you're looking at. And so they standardize that at 20 feet distance. So if you're 20/20, you're seeing what someone should be seeing at 20 feet. But if you're 20/30, what someone can see at 30 feet, you need to be standing at 20 feet in order to see.
When you guys were on call, what was your
She knows what she's talking about.
She knows, but then like you can learn that.
Yeah, you can learn that, especially when you know that you're going to have a video like this.
That's one of the first things when you complain of your leg, you can't see.
Yeah.
That's one of the first things that they do.
Yeah.
The exam.
But then to have that kind of context, man, to be so detailed like
no,
this.
but she's coming here to prove that she's a doctor.
That's true.
And she chose ophthalmology for a reason.
Okay.
favorite thing to be woken up by?
During my residency, I actually had a case of Stephen Johnson's, and that was very scary to see.
A large accident with fatalities is always a grim scene to come into, especially if children are involved. So that's the worst thing that I've ever had to do.
I got a little bit annoyed with the Tylenol call, but you know, I had to do
He's not the one.
My emergencies are mainly during like a practice or a real game. I've had ankle injuries that needed to be like lowered inflammation and put ice packs or certain, massage therapy.
I think just seeing any babies in pain and then seeing like a tragic loss is the hardest thing.
I haven't been on call as much, honestly, but I did have to see a patient for like herpes in his eye, so that wasn't very pleasant.
I think you're thinking
this last girl right there, I think she's been using medical terminologies. I haven't been on call pretty recently.
Yes.
Like it's like she's used to saying just like a tragic loss.
Yeah,
like,
tragic loss.
Obviously, you're going to be saddened by a tragic loss, madam.
It's the fact that they are not so confident in whatever that they're saying. They are not
especially
confident.
that man that I chose.
Yeah, the urologist.
Really,
He's not
he's not
confident.
at all.
He's
That
not
last
confident.
girl, like, she actually caught me by saying that I haven't been on call recently. Like, something like a doctor would just say, oh, I'm on
Exactly.
call. Oh, I'm not on call. Like, you get.
Yeah.
What I'm thinking?
What I'm thinking.
I'm thinking what you're thinking. Okay.
Okay.
We're ready to make an elimination.
Better eliminate.
Each team will try to find the real deal by eliminating the imposters. If both teams eliminate the same person, they will be removed from the game.
When you ask about why they don't like being called at night, you know, it's so sad and the children and this like general thing, I was like, okay, that's nice, but meh.
How long have you been practicing since, well, you're still in residency, so since out of residency?
I have been out of residency for a little over a year.
I graduated in 1993 and went right into work, so
28.
28.
I graduated medical school at 2021.
I've been practicing for 15 years.
I finished my residency at USC Medical Center 5 years ago.
And I've been out of school for 1 year.
Doctor number one, I have a question. For the medical terminology, intra versus inter, since you're a dermatologist, what's the difference?
Yeah, so it has been a while since I've been in medical terminology, but I definitely use inter a lot, and that would be inside. And then intra, gosh, I don't remember off the top of my head.
No,
Doctor number four.
Come on, that's like one of the.
No.
You should
You
like.
should know.
That's a word that is so diverse. Like it's
Yeah.
in all medical fields, and
Yeah.
you would know.
You would know. And she's a dermatologist. Please get out.
Nah, she's a dermatologist. No,
I'm
no,
like,
no.
when they asked her, like, she was like,
Nah,
please.
she's not.
Can you name me the different kinds of cruciate ligaments?
3? You said 3?
However many there are.
Oh, we got the anterior, interior. You have a meniscus. Those are the main for knee.
Gotcha. Doctor
He
number.
didn't say that with confidence.
Yeah.
He didn't say that with confidence.
Even me, I can say it better.
He didn't say it's confident.
Like anterior, posterior. Like, come on.
Meniscus, anterior, posterior. 3? Yeah. Like, why are you asking me if it's 3? You are the doctor.
Oh my God, that's so bad. You are not. You know what? The fact that if we've chosen the wrong person and we are insulting the actual doctor, you know what?
I mean, they deserve it.
Yeah, they deserve it. Oh my God! Imagine if that's us in the next few years. Oh my God.
3. What system is the lymph nodes a part of?
The lymphatic system.
Nice.
Are we allowed to eliminate 2?
No, just one.
Okay.
Why did she say that? It's correct.
Yeah.
Why did she say that?
I don't know why. Maybe
Did she know?
Maybe it's the confidence. He did not have
He
confidence.
said it with confidence. It was like the lymphatic system. He didn't even stutter. Did I stutter?
He didn't stutter.
Ready.
As a reminder, if both teams eliminate the same person, that person will be removed from the game.
When I asked him to name me the cruciate ligaments, and he answered with
Meniscus.
which is not a cruciate ligament. As a physical therapist, you should probably know that.
Doctor number 5, could you
He's
tell
probably
me?
just heard the word meniscus somewhere.
Huh?
He's probably just heard the word
meniscus somewhere.
He just said it.
Yeah.
A common medication that you prescribe for one of your patients?
Benevate, it's for babies that have phimosis before they get circumcised. We try that method first. An average is like 50 milligrams.
Doctor number 5, I had a question for you too. For a baby under 28 days, if they had a fever, how much Motrin would you give them?
Ideally none.
Ooh, she knows her stuff. Okay. Go ahead.
Doctor number 6.
Okay, doctor number 5, you're onto something.
Yeah.
You're onto something. Maybe she's the real deal, man. Okay.
If a patient had glaucoma, what kind of prescription would you give them?
You could give them something called latanoprost. So it's an eye drop. You'd use that one at nighttime only, in whichever eye had the glaucoma.
And then what would be the abbreviation for nighttime only?
QHS.
Come on, this is our doctor. This is our colleague. Right
Okay,
here.
I'm beating number 5 and 6.
It's a colleague.
This is colleague. Are you a doctor yet?
No.
I'm beating
Oh my
number
God.
5 and 6 right now. I'm beating number 5. But number 6 answers her things like it's something that she does.
Yeah.
But number 5 like says like she's learned. Excuse me. She's learned a lot.
But what if she was a medical
What if
student?
she's a nurse?
What if she's a nurse? And what if she was in med school?
But
then,
she's in the medical field, just not a doctor.
Or maybe she was in a medical field. She was a med student, and then she has dropped out of. Yeah, she stopped.
Yeah, maybe.
Our resident, number 3, can you tell me what a normal blood pressure is and then kind of explain to me what those numbers mean?
120 over 80, and 120 is a systolic, so pretty much the amount of blood that's in the chamber before it's ejected, and then the bottom number is basically the resting volume.
1 and 4. Could you tell me what kind of cars you guys drive?
Wait.
I don't understand.
Wait.
Wait.
What?
Why?
What's the purpose of the question?
What's the purpose of the car?
Maybe he wants to know compared to the money you're making, what kind of car you're driving. Maybe.
You can be having a side, like you can have a side hustle.
Side hustle.
1 and 4. Could you tell me what kind of cars you guys drive?
I drive a Toyota Honda Highlander.
So I have been driving the same car since I was 15. I drive a Honda CR-V. I am still paying off medical school, so I will be driving that until it cannot be driven anymore.
Nice.
I think we're ready to make another elimination.
In this round, both teams have decided that one person is definitely not the real deal. Number 4.
We'll miss you.
Thank you.
Sorry, bro.
I would love to hear your wackiest story from a patient on the job. Down the line, sorry. I'd love to hear from all of you.
So we had a TikTok star in one time, and when I entered the room, he was standing on the medical bed, filming something, pretending he was surfing. So that was definitely very interesting.
Noah Beck.
It was a
I mean, that's such a that's a story that you can think off the top of your head. Like, come on. And they asked you like, if you are really what did she say? She was dermatologist. You cannot bring up something about the skin that happened that scared you. What do you mean by you had a TikTok stand?
Maybe that's the funny. Isn't they say the?
They said wacky.
Okay, let's hear it.
vaginal occlusion. She and her friend had been playing around with a bottle and created a vacuum, therefore lodging the bottle in her vagina.
I had this elderly patient. I had this elderly patient. She has some sundowning, some form of dementia, but she kept asking me to go to the bathroom with her to show her a good time.
A mother asked me, is it okay to put
Oh, the mom wanted to get some.
Yeah.
eyelashes on her newborn baby for pictures.
For me, I had a guy come in because he was playing with a Nerf gun, and then I guess he got hit in the eye, and then he ended up having like traumatic uveitis, and then he got some glaucoma as a result from that, so that was pretty crazy.
Nerf or nothing, right? All right, we're good to eliminate.
Doctor number 2.
Sorry, sir.
Definitely not.
So we were number 2 next because there were very broad answers given. It wasn't very specific to what a urologist actually does.
So this is a question for doctors 3 and 5. You walk into the room and you see the patient's monitor flatline. You feel their pulse, there's nothing there. How many joules are you going to shock them with? Doctor number 5.
5.
And doctor number 3.
200.
Doctor 1?
It has been a while since I've been in the ER. I am a dermatologist after all, but if I remember correctly, it's 150 joules.
Okay, and Doctor 6?
Yeah, so I definitely don't work in the emergency room, so I don't really work with that. I'm not sure.
That's fair.
Okay. That was a question everyone got wrong. The answer is none, because you don't shock asystole. But that's something medical TV sometimes gets wrong. Everybody comes in there with...
Oh my God. I did not know.
So
Do you know?
Doctor,
I did not know. Did you know?
I didn't know that you're not supposed to shock asystole.
I thought okay.
Cause usually when the, but I guess I don't know.
I saw this one. I was lost as well. I thought I was. Do you know what came to my mind? Was Grey's Anatomy.
Paddles, ready to go.
I don't know. I don't know who's
I don't know anything
the real
anymore.
deal at this point.
Okay, I have a question for doctor number 3. So earlier I asked you what system the lymph nodes are a part of. You said the lymphatic system. What's the major system that it's a part of?
I know that I know it recycles like dead cells, fights off infections and whatnot. I'm just like at the tip of my head. I'm just like nervous right now, so I can't.
Doctor number 1, do you know what the answer is?
I believe
Immune
it's the
system.
circulatory system.
Doctor number 6, do you agree?
The immune system.
Sweet. Okay. Doctor number 5, what is the average heartbeat of a newborn versus a 1-year-old?
For a newborn, it's lower, so maybe like 35 beats per minute. It elevates by the time they're 1, obviously, so maybe like 40, 45.
Okay, I'm ready to make an elimination.
I'm ready too, yeah.
Okay.
Might be wrong, but you know.
Doctor number 5.
Eliminated. That was definitely
Talked about
wrong.
the heartbeat for a baby. That gave it away.
She answered that a resting heart rate of a fetus or infant is 35, which it'd be very concerning if it was that.
35.
Yeah, they'd be not alive.
Okay, I think we're gonna have
So maybe not alive.
demonstration.
I know.
I was just gonna have Dr. Number 6 do a little eye exam with my pen light on Andre, and tell us what she's looking for.
Let's see what Dr. Number 6 got. Is she a pro or not?
She knows.
She's
Bruh.
nervous. She's nervous.
Yeah, she's nervous.
Like,
But this,
she's like, I didn't read this.
I'm not doubting her.
Yeah, but I think it's from when she was like, she doesn't know about the what's it called? How many Jews you used to shock. So from that.
Yeah, that is all.
That's in her.
But she said not
And then
sure.
she said
She no. She did not. She said I'm
she
not
said
sure.
I'm not sure because I've not
Yeah,
worked in it.
which is something that you do. If you don't
What's
know,
the
you don't
answer
know.
to the lymphatic system thing?
It's the immune system.
So
Like
she
the
got
major
it.
system.
She
No,
got
she
it.
did not.
She said immune system.
Oh yeah, she got it.
Dr. Number 6 do a little eye exam with my pen light on Andre, and tell us what she's looking for.
Let's see what Dr. Number 6 got. Is she a pro or not?
See those skills in action.
All right, so first I'm gonna be checking to see if your pupils are equally responsive to light and if they are equal in terms of size. I'm gonna do the direct response first, so just look straight ahead for me, please. Cool, so when I shine it between the two eyes, I'm looking to see if the other one stays constricted because that means that there's like a good communication between like the brain. So that's what I'm looking for.
Okay. It's okay.
She has sold me so far.
She's good, but I did not like the confidence.
Really?
Yeah, she's not.
She might just be nervous.
Yeah, maybe she's just nervous.
Because like then again, like it's a shoot. There's a lot of cameras on her.
Yeah. But then the way she's like, I want to look at your your pupils, so that, like, come on, you can do better. You can't be talking like that in front of a patient. Like, even if I was the patient too, I was like, I'll be like, are you sure?
I don't trust.
I don't trust you. Yeah.
Number 1, can you tell me what medication you typically prescribe to patients with cystic acne?
Yes, so if the acne is bad enough, we're gonna put them on Accutane, but that is a high-risk drug, so we have to make sure that the women come in every month and give us a pregnancy test. And then I also recommend to not drink very much when you're on that medication, and that goes for men as well.
Wow, that one is correct. But then, what's the name of it? She also got even the
test to do
the side effects. People who are pregnant are supposed to take Accutane, but then it's a general thing. You know, people keep on posting about Accutane on TikTok and everything. She could have Googled.
And then again, the fact that she's coming as a dermatologist, something that she might have studied. Acne is.
Yeah.
That the women come in every month and give us a pregnancy test. And then I also recommend to not drink very much when you're on that medication, and that goes for men as well.
Last thing, does a bar of soap clean the face pretty well?
It can, yes. I have some patients that don't even use soap when they wash their face, and they have beautiful skin. So it kind of just depends on your physiology.
Thank you.
We're locking in the real deal.
Doctor number 6. What is that machine called that blows air into your eye?
Yeah, so that's called it's a non-contact tonometer. It measures your eye pressure to screen for conditions like glaucoma.
The cones that are in our eye, what do they do?
So they help you perceive color.
What colors do we see?
Okay, sorry, I'm trying to think.
Nah. You can't, like, it's one of the, is it, I think it's one of the, okay, me, I've forgotten the exact colors. But
I
then
don't know as well, but the fact that you're an ophthalmologist,
exactly,
you're a specialist,
exactly.
You're not a resident anymore.
Yeah. You're supposed to know, like, you're not even supposed to think about them, because that one is a basic question.
That time you said you're not an emergency doctor. We understood. Now this is your specialty. You should know everything.
Everything. Like, it's a basic question. Like, I'm telling you, it's a primary question. We just did ophthalmology, but then it was on a primary basis, like not really deep. But then we did ophthalmology, and we did this. It was one of the general questions.
Yes.
So I feel like she should know.
It's a special.
But it's something that doesn't come up. Like, it's not clinical. So
yeah, she might have forgotten as well.
Red, green, and yellow.
Doctor number 3. Talk me through intubating someone. What are you trying not to accidentally push it down instead?
You're not trying to push down the tongue so that they don't or it doesn't block the airway.
Okay. I'm gonna ask one more question real quick to doctor number 1. Somebody has a mole. They want to get it checked out. What are some things they should look out for?
So changes in shape, color, if there's any pain, that's definitely something we want to know. And then throughout the mole, if there is different kinds of colors and textures, that's something that we want to look at as well.
That is all I needed.
One of you is a real doctor. The other 5 of you are going to jail for impersonating a doctor.
I mean, number 1, she's been good.
Yeah, she's been good, but she's been
had
falling.
Some mistakes as well. All of them, to be honest.
We think the real deal is doctor number 1.
Dermatologist. We think she was knowledgeable about everything that she explained. She didn't really know the jewels, but like she said, she's not in the ER very often.
We think the real deal is doctor number 1. She didn't fumble on any of her answers, and the more that she kind of got into it, the more I felt that like she was a doctor talking to me as a patient.
In the event that both teams lock in the real deal, the team...
But why didn't they choose number 6 though?
She had mistakes, like obvious mistakes.
I can't remember her mistakes though, but I feel like she carried me on. But okay.
Locked in their guess first wins. If the lights on the floor turn green, that means that you have chosen the real deal. If they turn red, that means that you have chosen an imposter. The real deal will be revealed in 3, 2, 1.
What the hell?
Who is it?
I knew it!
Yes. Hello, teams. My name is Rebecca. I am not a doctor. I was in the medical field. My original plan was to be a PA, but then I left medicine. I went and got my MBA, and now I'm in marketing. I stopped working in healthcare 4 years ago, so it was a bit of a memory kind of situation. I was an MA for dermatology and plastic surgery private office.
That's why she was so good.
Yeah, that's why she was so good.
She's worked.
Wow.
She's so good.
Oh my God. I feel bad for the doctor. Like, I feel bad for the real doctor. Oh my God. It's the fact that it will seem as if she does not know what she's doing, you know? Oh my God. That's crazy.
Because you're not able to find the real deal, we will reveal them to you.
I know it.
It was right there.
I should have gone off the cones. Should have gone off the cones.
Hi, I'm Nicole, and I'm the real doctor. I think sometimes maybe the way I speak can come off a little ditzy. I don't know if it's just my own persona of myself, but
True.
I feel like some people don't really look at me and assume that I could be a doctor. I think that Doctor Number One did an amazing job. Like, I literally would go to her.
Wow.
She's just really nervous.
Yes.
Really nervous.
Oh my God, I'm so proud of myself, bruv.
Yeah.
I see this, like, literally, you were just looking.
Yeah, I didn't know who the doctor was.
Oh my God, that was crazy.
Yeah.
What? Jesus Christ.